There are 8 facilities in the department that have an SSNU. The special needs units, or SNU, 18 of our facilities have units for those populations. Mental health units, we have 4 facilities that operate mental health units through a contract provider. General populations, the medical infirmaries, the DCCs, at not only at Camp Hill, but Pittsburgh, Bradyford, and Muncie. Of course, our facilities have restricted housing units to house those offenders that are either disciplinary custody or administrative custody. We have 2 facilities, Camp Hill and Fayette, that have special management units, 50 beds at Fayette and 24 beds at Camp Hill. Of course, the capital case units for capital offenders at Green, Bradyford, and Muncie for the female offenders. The forensic treatment center at Waymart, in addition to their SAU and ICU units, and the therapeutic communities that provide treatment for those offenders identified as having alcohol and drug abuse issues. And we currently have 49 TCs at 27 facilities, about 2,600 beds for that purpose. And then we have the special observation unit at Camp Hill. Our facilities have been accredited by the American Correctional Association, which sets the standards for accreditation purposes. Some of the benefits of having your facility accredited: improve staff training and development. If you're able through the accreditation process to assess program strengths and weaknesses, the accreditation process provides some defense against lawsuits. The process establishes measurable criteria for upgrading any operations. Because staff isn't totally involved in this process, there's an improved sense of staff morale and professionalism. The environments are safer for the staff and the offenders that live there. And accredited facilities can get a reduced rate in liability insurances. And of course, the audits provide for performance-based benefits. On August 14, 2006, the ACA Commissioner on Accreditation presented its Eagle Award to the Pennsylvania Department of Corrections in recognition of the department's outstanding contribution to corrections and having all of the facilities accredited. The staff overview that work in our facilities in Pennsylvania. Of course, we have the PSCOA, the correctional officers, food service, and maintenance staff. We have management staff. We have ASME staff that consists of our LPNs, clerk typists, food service supervisors, and some other classifications that refer to supervision. The PSSU that represents our DATs and counselors. CIVIA represents the education component. STIU represents the RNs. OSEP represents the librarians. OPIU represents the nursing supervisors. And the PDA represents the dentists. A little bit about our staff training. We're very proud about how we train our staff. Our Elizabethtown Training Academy is recognized nationally and internationally. The Department Staff Training Program is one of the largest and most comprehensive state correctional training operations in the United States. And as I said earlier, it's known nationally and internationally as a model program that ensures all employees receive the best possible training from the time they are hired to the end of their career. A few years ago, we had the opportunity to train some corrections professionals from Ghana. They attended our training program at the Training Academy and spent some time in the field, putting their newly acquired knowledge into use and observing how Pennsylvania operates its facilities. And we recently had last fall, there was some more interest noted in running the same program, as we had a lady from, I believe she worked for the Department of State, tour the Elizabethtown Training Academy with the intent of perhaps resurrecting that program and training some more corrections professionals from another country. The Department staff training meets and in many instances exceeds all state and federal requirements, certified by the International Association on continuing education and offers continuing education units, approved by the VA Department of Labor and Industry, and approved by the Department of Veterans Affairs for VA educational benefits. And we've also entered into agreements with DeVry University and the University of Phoenix for continuing education. And in this slide simply basically outlines some of the minimum pre-service training requirements as far as orientation, basic training, and on-the-job training programs. The on-the-job training program for the corrections officers, a formal structured program, takes 44 weeks to get through. It's divided into phases, phases 2, 3, and 4. Phase 2 are those posts that are defined as being a multiple post, where the trainee is generally working with another officer or in close proximity to another officer. And again, that phase is 13 weeks in duration. Phase 3 are those posts that are identified as being a single post, where the officers pretty much work by themselves using the acquired skills and knowledge that they've learned from phase 2. Some of these posts would be education posts, infirmary posts, and examples of some of the phase 2 posts would be housing units, yard dining posts, and search teams. And then finally, the phase 4, those posts are those restricted posts where they're high security sensitive posts, such as our RHU, mental health units, and transport and hospital posts, where the officers don't work by themselves, they work with another CO. In-service training, in addition to pre-service training, all employees must attend the annual in-service training. The specific topics are varied based upon the classification, and they rotate on a yearly training plan. The emphasis on mandated training is to ensure staff maintain good security, safety practices, and prepare employees for their new duties, including special assignments and promotion and assignments. And basically, helping the employee to realize their potential and enhance their career goals, and help them meet their career goals. Tim?
Okay, we'll talk a little bit about what we do now and what goes on in the Department of Corrections. For those of you who work in the institutions, which are most people in the room here today and others, this is no surprise. It's a surprise sometimes to people outside of the department that don't expect that all these services are provided, but as an inmate doesn't go out of the facility, we have to bring these activities into the institution. And I won't mention all of those. You can see the slide there. I'll just go to the next slide. We'll start to talk about them individually. Food service operation. We have 752 total staff for positions. Some of them may be vacant at any one time, of which 590 are in this bargaining unit, and approximately 7,500 inmates that we employ in food service to prepare all the meals that total over 58 million in 1 year to the inmate population and to the staff working in the facility. All food service staff attend food service and sanitation training. This is a large employer within our facility, probably the largest in terms of where we put inmates in the institutions. The next slide, talk a little bit about medical. Our medical department maintains skilled care facilities for 24-hour inmate medical care and also emergency first aid care for staff members. Medical costs across the country are growing. It's no different for the Department of Corrections, especially for a population that continues to age and we get more acute cases. What we have been doing to try to counteract some of that in the institutions is looking at specializing some facilities across the state. Our dialysis center at Laurel Highlands is a good example of what we're doing there. We save approximately $2.6 million by bringing those services in-house, which we've done a few years back. We also have oncology services at Greaterford, where send inmates that are saving us, well, just in this last year, $1.1 million we estimated by housing at one facility. We also have consolidated our short-term surgery unit at Somerset, hemophiliac treatment at Pittsburgh, Hep C liver biopsy at Dallas, Hep C treatment at Dallas, Forest, and Muncie. We also have consolidated infirmaries at different institutions. One other thing I want to say in this regard, of a few years back, probably about 10 right now, I don't have the exact date in front of me, but we instituted a copay for inmates for medical services. The copay currently stands at $5, and with that $5 that is charged for a sick call visit, if it's initial sick call visit, $5 copay for pharmacy. Now, if there's maintenance medication or if you are a continuing patient that the doctor wants to see, we don't charge for that continuing service. One may argue that that's not a lot of money for a copay, not what employees pay, but I would like to point out that the average inmate pay that they receive from the DOC is approximately $30 a month, so it's really 1/6 of the salary for one visit or one medication that they receive from the department. And we are required to provide those services to the inmate population. Moving on to education. As you can see from this slide, more than 13,600 inmates attend academic or vocational classes on any one day. And more than 1,700 inmates earned their GED in 2010. Less than 50% of the inmates enter the Department of Corrections without a high school diploma or a GED. We also have 4,400 inmates completing a vocational training program. Why this is important is that studies have shown that education does have an impact on the recidivism rate. I had heard some talk earlier at these sessions about a high recidivism rate, so I just want to make a point that the actual recidivism rate in the 3-year study that was produced in 2007 was 43% of the inmates will return within 3 years. If you go out higher to 5 years, which we don't have that data available because it wouldn't be there, there's another 5% or so that would be added on to that, at least from historical numbers. But the education, we conducted a study recently that showed a 5% reduction rate for inmates in vocational education. And there was another study by Linda Smith of the Correctional Education Association back in 2005 that shows a lower rate of rearrest of 23.6% compared to the non-participants of 29.4%. So that education is certainly a valuable resource that we have. We move on to treatment programs. We conduct our treatment programs using the principles of effective correctional intervention by targeting the specific risks and needs of an offender through effective treatment. Recidivism is reduced and both community safety and the safety of our institutions are enhanced. As you see, we put through a number of inmates in our drug and alcohol treatment program that 18,000 inmates is what are in programming and what have received programming in the past that are in our institutions. In addition, we offer the programs, as I mentioned, using principles of effective correctional intervention in our violent behavior, our criminal thinking, our sex offense training, our psychiatric and mental health and reentry issue training, and or treatment. What we are looking at, once again, is to give the inmates programming in order to